First, we could say to those people who could have afforded insurance, that didn't get it, and who, let's say, had a heart attack, we're sorry, we're not going to treat you. That, however, goes against the Hippocratic Oath, and it's against federal law. You're required to treat those people. So that's really not an option. The next option is the one that was being exercised in my state. We had the taxpayers pay for them. We were spending hundreds of millions of dollars. We're basically mandating to the taxpayers, you've got to take care of these people. We're adding it to your insurance premium, or we're adding it to your tax bill, but you're going to pay for these folks. And we said somehow that's a big government approach. That government and taxpayers are going to give to people something that they should be able to get for themselves. And so we chose the last alternative, which is to insist on personal responsibility. And to say to folks who could afford to buy insurance, either buy insurance yourself or pay your own way. And ultimately, the bill that we passed was a bill that said either have insurance or we're going to charge you for the cost of the fact that the state is going to have to cover you if you get seriously ill. And the charge maximum is about $120 a month. Obviously, well less than the cost of insurance, but a pretty big incentive to encourage people to get insured. Now, let me note here, this again, under the 10th Amendment, was a state decision. Other states can take a different choice, but the state decision we took was to insist upon personal responsibility. Now, let me tell you for just a moment about why it is that we decided to go ahead and put in place our plan. First of all, I'll note that about 94% of our population in my state was insured before we put this plan in place. For that 94%, there was no change in their insurance policies. The program remained the same. So we're dealing with that last 6% that were uninsured. But that last 6% sounds like a small percentage, only 6%. But that's 500,000 people. I don't know how many people in this room have lived without health insurance. But I have not only family members, but dear friends who have lived for one time or another without health insurance. It is a frightening experience. You wonder, what happens if I get ill? Or more seriously, what happens if my child gets ill? I had 500,000 people who I was elected to serve who were frightened because they didn't have insurance. As a result of the plan we put in place, about 400,000 of them are now insured. And I'm pleased with the fact that we were able to accomplish that. The other people who have insurance, the 94%, there's another feature for them. They don't have to worry about losing insurance if they change jobs or develop a serious condition and then change jobs. Because under our plan, everybody in the state is able to get affordable insurance. I also note there's no government insurance here. We didn't create a government insurance program or a government policy that people got. No, we gave people a premium support program where they could buy their own private insurance of their choice, and for the poor, we helped them with support. The analysis of what the cost of the program would be was carried out by a group called the Massachusetts Taxpayers Foundation. They're an independent think tank funded largely by business interests. They looked at the Massachusetts healthcare system after reform, and they concluded this, that the cost of the system is relatively modest, and that it costs less than 1% per year of the state budget. Now, that's not free by any means, but it's not what some people might have thought. Some people might think, oh, did this thing cost half your state budget? A quarter of your state budget? 10% of your state budget? No, it costs less than 1% of the state budget. And by the way, I think that's too much. If I were governor, I'd get it down to zero. Because don't forget, we were already paying for people who were getting free care. I wanted to limit how much we were going to pay in the future to that amount that we had already been paying. All these things we did without a tax increase. Now, I know that with that summary about what we did and its differences with President Obama's plan, that explanation is not going to satisfy everybody. And I respect the views of those who think that we took the wrong course and who think we should have taken a different course. I also recognize that a lot of pundits around the nation are saying that I should just stand up and say this whole thing was a mistake, that it was just a boneheaded idea, and I should just admit it it was a mistake and walk away from it. And I presume that a lot of folks would conclude that if I did that, that'd be good for me politically. But there's only one problem with that. It wouldn't be honest. I, in fact, did what I believed was right for the people of my state. And I'm going to describe for you now what I think would be right for the people of the United States, which is quite a different plan. Now, I'm going to turn to repeal and replace and go back to the question again, why repeal? I told you some of the things I didn't like about the president's plan. Let me give you some more. And I'm going to start with just an overview again of our healthcare system. And I know we have doctors and professionals in the medical community here, so you'd probably elaborate on this, but just a couple of thoughts. There's some major advantages of our healthcare system relative to those in other nations in the world. I believe we have the highest quality healthcare in the world. We provide to our consumers an extraordinary level of choice and freedom. We attract to the profession the best and brightest from among our population. And we're the most innovative place in the world for medical technologies and drugs and instruments and devices and so forth. We do, however, have some disadvantages in our system. It is a high-cost system. It does not have, by and large, portable insurance. People are worried that they might lose their insurance if they change jobs. We have about 50 million people that don't have coverage. And when I say tax discrimination, what I'm referring to there is that individuals that want to buy insurance on their own are treated differently under our tax code than people working for a big company where the company buys the insurance for them. That's tax discrimination. Now, unfortunately, the president's plan, at least in my view, detracts from some of the best things of the American healthcare system. It hurts the quality of healthcare by having healthcare more dominated by government. It also reduces consumer choice by having government play a bigger role in deciding what insurance you can get and what will be covered under your insurance. It repels the best and brightest. Now, I know there's some doctors in the room, and so I'm not going to ask for witnesses here, but my son went into medical school, and he talked to a number, there are no Romney doctors in my immediate family, so he talked to a number of people who were doctors and said, what do you think about going into medicine? And almost without exception, they said, don't do it. Unless you really, really love it, my goodness, this is a tough profession to go into because of what's happening by virtue of government's heavy hand in medicine. There's no question in my view, but the president's plan will tend to repel people from coming into the medical profession. And finally, I'm afraid that the Obama reforms discourage innovation. Heck, when you tax people who are developing devices and instruments that are used in medicine, they're going to have less funds to invest and create new innovation. But there's more wrong with the president's plan. I believe it's an economic nightmare. It does not lower health care cost overall in our system. It raises taxes. It diverts Medicare funds. And it kills jobs. Let me tell you, as I go around the country and talk to business people, and I was one for 25 years, when you explain and when they understand the implications of the ObamaCare program on them, they're less likely to hire people. They're concerned about the cost of ObamaCare on their ability to hire and train workers. It kills jobs. It is, in my opinion, one of the reasons why this recession has taken so long to get out of, and why we have 20 million Americans unemployed, underemployed, or have ceased looking for work. There are more things I don't like. I don't like the massive federal spending. I don't like the power grab from the states. I don't like the massive federal bureaucracy. The Republican Joint Congressional Committee tried to chart out how Obamacare works. Prepare yourself. This is their slide. That is not a pretty picture, and suggests to me why it is that people are a little concerned about getting into the healthcare profession. So for all those reasons, if I were lucky enough to be in the White House in the position of leadership, on the first day I would issue an executive order paving the way for Obamacare waivers to be given to all 50 states. And then I'd go to work with Congress to make sure that we could repeal Obamacare. But now let's look at what I do instead. You won't be surprised here, because what I'm going to describe to you is basically the same structure that I described 4 years ago when I was running for president. I should note, by the way, that was a time when my Massachusetts health care plan was considered, at least by me, to be an asset politically. I hear some laughter in the room. That's not the case now. But you will note that despite the fact it's gone from being seen as an asset to being seen as a liability politically, that the plan I'm going to describe for you is the same. I'm not adjusting the plan to reflect the sentiment, the political sentiment. The plan, in fact, starts with the same elements. And let me begin with what I consider the objectives of my plan. One is do no harm. Two, strengthen the current healthcare system by lowering costs and improving quality. By providing portability, that's the ability to know that you're going to keep your insurance if you change jobs. Improve consumer choice. And then expand health care by dealing with those individuals who have pre-existing conditions fairly, and provide greater access to care for those that are low income or uninsured. 5 principles. Restore states to leadership. Empower individuals to purchase their own insurance. Focus our federal regulation as opposed to making it overbroad and over-bureaucratic. Reform our medical liability system. And introduce market forces to health care to the extent possible, one by one. Restore to the states the responsibility and the resources to care for their own poor, their own uninsured, and their chronically ill. The state is the best place to determine who's poor. The state is the best place to determine what's the best way to help those poor. And so I would therefore block grant to the states Medicaid funds and so-called DSH payments, disproportionate share payments, and other medical payments to the states, and say, states, you now use these monies as you feel appropriate to care for your own poor. I'd limit the federal standards to those that were absolutely necessary. States, of course, will experiment and learn from one another, and they'll have flexibility to deal with the uninsured in the way they think best. Some will decide that they want to understand the role of charity in their state, and can it be expanded? Others will say, let's put in place exchanges like we did in Massachusetts. Some will decide to give subsidies for private coverage. There'll be different alternatives chosen. There'll also be flexibility to deal with the chronically ill population with high-risk pools or reinsurance plans and risk adjustment. These ideas will be tried out and are now being tried out by various states. Of course, until Obamacare got passed, at which point most of that got put on ice because obviously the federal government was taken over. Second point, empower individual ownership. I think this is critical. I would make sure that we give the same tax treatment to individuals who buy insurance that we give to individuals who get insurance from their big employer. Now, what would that do? In a lot of cases, an individual is going to say, you know what, General Motors or Ford or Chrysler, I have to be fair here, instead of taking your plan, I want to buy my own plan. So you give me the amount of money that you're paying for Blue Cross Blue Shield here, and let me pick my own plan from Blue Cross or from anybody else I want. And when that happens, you're going to find people choosing plans that fit their needs rather than plans that have been put in place by the Human Resources Department of a big corporation. This gets greater consumer choice so that people can buy what they want, not just what their employer wants to give them. It promotes, of course, portability. Why is that? Because if I own my own health care insurance, I don't lose it if I change jobs. I'm continuously insured as I go from job to job. And of course, by virtue of that fact, and the fact that I'm choosing what I want myself, not just what is given to me, the cost of health insurance in the choices that people make, in my view, is likely to come down. Focus federal regulation. We got to make the markets work better. A couple of common failures I'd go after. Ensure that individuals with pre-existing conditions who are continuously covered for some specified period may not be denied coverage. So you're not going to say to somebody, if you've never had insurance and you're age 55 and suddenly you have a heart attack and now you want to buy insurance, you don't say to them, oh, fine, you get it. That doesn't work very well. You say instead, if you've been insured for 10 years and you have a heart attack and you've changed jobs, because of that continuous period of insurance, of course, you will continue to be covered. Empower individuals and small businesses to form purchasing pools. Eliminate some of the counterproductive federal constraints, removing barriers to the sale of insurance across lines. Let people buy products from other states if there are superior products in the consumer's view. And of course, allow providers to design plans, insurance plans, that meet the needs of consumers across state lines. Reforming liability. I don't have to tell you about the burden of our medical liability system on our healthcare system, We should cap non-economic damages in medical malpractice lawsuits, and we should provide innovation grants for state reforms like health courts, alternative dispute resolution, and so forth. Market forces. I'd like to make healthcare work more like a market and less like a government agency. I'd like to make health savings accounts, which really empower the consumer, far more efficient and effective by such things as permitting health saving account funds to be used to pay the insurance premiums, which isn't allowed today. I also like some of the new innovations in insurance, like co-insurance. And we were talking earlier with the members of the team here about value-based insurance products, where co-insurance, for those that are not familiar with the term, we've all heard of co-pays, where you pay, let's say, $10 for an office visit. Co-insurance would say, I'm going to pay 10% of my total bill. Now, when that happens, I, as a consumer, care how much that total bill is going to be. I care about the quality of the provider and what the total bill is going to be. And that kind of product, I believe, would lower the premiums and give people a much greater stake in thinking about the cost and quality of the care that they're seeking. I like the idea of a consumer reports type approach where Consumer Reports itself or others like it would rank different insurance programs around the country and which ones provide the best coverage for the best value. I'd like to facilitate information technology interoperability among providers and establish cost and quality transparency. And finally, I know a number of you are already doing this in the health community, but promoting alternatives to fee-for-service with capitated rates or bundled payments, I think, has a lot of promise. So where are we with regards to my objectives? I think we've done what I suggested at the beginning. We haven't done harm. I think we've strengthened health care, and we've expanded health care to those that don't have it. Let me mention a little more on health care cost. How do we get health care costs down? Well, one, we for the first time allowed individuals to purchase insurance as an individual without being penalized on a tax basis. Two, we're going to introduce market dynamics where consumers care what something costs, as I just described. We're going to reform the medical malpractice system to keep the cost down of defensive medicine. Providers will have an incentive in the non-fee-for-service-based approach that I've described for quality, not just quantity. Medicaid ceases being an open checkbook for states to say, I'm going to expand more and more people on Medicaid because I know the federal government picks up half the bill. And finally, there's going to be greater competition across state lines as people are able to buy insurance from other places and join into purchasing alliances. Now, let me note that there is more to come, that there are additional specifics that you expect from me, and they'll be coming. I also note that there's going to be a lot that you're going to expect from me on Medicare reforms, and that's a big part of health care. Will have an enormous impact on the overall system. Let me just make a couple of points. One is I applaud the fact that Representative Ryan put forward a plan to keep Medicare solvent. That's got to be our primary objective, and to keep our country fiscally solvent as well. And he's also added choice to his plan and inserted market dynamics. And I'll note that while I haven't introduced today my own plan, will in the future, it's not going to be identical to the Ryan plan, but it shares many of those same objectives. Now let me conclude by summarizing differences between the output of President Obama's plan and my plan. And as you might imagine, the comparison will be favorable in my direction. First, ObamaCare raises taxes. I don't. He diverts Medicare for ObamaCare. We do not divert Medicare for a health care plan. His creates massive new federal bureaucracies. Mine creates no new federal bureaucracies. His reduces consumer choice. I dramatically increase consumer choice. His, I believe, will raise health care costs. Mine lowers health care costs. His involves massive new government spending. They admit to $1 trillion over a decade. It'll be a lot more than that down the road. Mine reduces government spending. His includes mandates on individuals, on corporations, and on states. Mine includes no mandates. We let the states create their own plans. His is dependent upon the federal government deciding who's poor and how to insure them. Mine gives the state the responsibility to care for those that are poor and uninsured. His discriminates on a tax basis against individuals and small businesses, by the way, where individuals often don't get coverage from their employer. Mine provides for tax fairness. And in my view, his includes overly broad pre-existing condition rules. Mine has, I think, fair and reasonable pre-existing elements. I like what we've worked on and put together. If I am the nominee on the Republican side of the aisle, and I get the chance to debate President Obama, this is what we're going to be talking about. Who has a better plan for America? Which list is a more favorable list to the American people? And I'm confident that when considering those two plans, the American people will say the Mitt Romney U.S. reforms, that's a lot better than Obamacare. Thanks so much. Good to be with you today. Thank you.